episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Well, welcome everybody again to another episode of our show with another really fascinating guest helping to make a better tomorrow. Today we have the honor of being joined by Dr. Roger Schechter, who is the Chief Medical Officer at a company called Exocel Bio, which is focused on merging the emerging knowledge from this exciting space of exosome biology with nanoparticle technologies for really interesting therapeutic applications in the area of cellular regeneration. Dr. Schechter also serves as the medical director for wound management at Palomar Health in San Diego. He's the chief medical officer at Synergy Wound Technology. And with his medical degree from University of California, San Diego, and training in emergency medicine, he practices full-time as a wound care and hyperbaric medicine physician. He's been active in wound care management practice research for the past 20 years. He practices across the continuum of wound management in both inpatient, outpatient, and long-term care. In addition to all those roles, Dr. Schechter currently serves as a consultant to industry, and he helps to bridge the many divides that ultimately separate and sometimes get in the way of the clinical research, the basic research, and the business, of course, for biotech companies, especially in the area of wound care. He's very active in digital health applications as well. Sort of in the research front, he's involved in everything from protocol development, marketing insights, strategic planning, as well as outcomes, health economics research, and so forth. He's a very active speaker on the national level and regarding wound care, advanced wound care modalities, and non-invasive vascular testing. And he's spoken internationally about clinical research as well. He provides a range of science-based educational programs on behalf of wound care product manufacturers, and also frequently serves as a medical legal expert regarding wound management. And on that front, he has provided advice to counsel, evaluation, testimony in over 80 cases to date involving allegations of medical malpractice and elder abuse in relation to development of chronic wounds and skin breakdowns, different etiologies. Dr. Roger Schechter, thanks so much for taking the time to come on the show today.
Well, thanks for having me, Ira.
It's great to have you here. You have a really fascinating background, and before we get into Exocel, I'd love to, as we typically do, sort of hand you the floor for a few minutes just to talk a little bit more about yourself. If you could sort of just take us in the audience a little bit of your background, everything from where you grew up, how you got interested in medicine, and sort of your path into this really fascinating domain of wound care. I think that'd be a great way to start things off.
Well, I am pretty much a Southern Californian. However, I took a detour to Texas between the ages of 6 and 11, and then came back and have done most of my medical training in California. Also spent a year in Washington State doing my internship. Otherwise, I did emergency medicine from the time of completion of residency in 1985 all the way to 2009. That which took up my time and displaced emergency medicine was chronic wound management. And for people who don't know what that is, chronic wound management is taking care of people who have wounds that do not heal for long periods of time, usually caused by some kind of underlying chronic condition like diabetes or disease of the veins, disease of the arteries, that type of thing. And also people who are frail and immobile can get what are commonly known as bed sores, but that are technically known as pressure injuries. And most of my time between when I first started doing that in 1999 and to the present has been in outpatient care, taking people in a specialized, taking care of people in a specialized wound clinic, and also seeing people in the inpatient setting and at skilled nursing facilities, and taking care of people through home health in assisted living or in their own homes, all of whom are suffering from some type of long-term non-healing wound.
So, Roger, you're, at Exocel, you are involved currently with, this fascinating domain of exosomes, which, is an extremely exciting topic, and what I sort of refer to as sort of the post-stem cell era, where we had a lot of excitement for the last couple of decades in stem cells, realizing that hey, there's a lot of interesting stuff that stem cells are secreting, giving off to the external environments, which are involved in really complex forms of communication. And exosomes are, interestingly, they wear two hats. They're a biological on one front, but they are also this really neat delivery vehicle as well. Take us, sort of on a top level, sort of introduce the audience to what exosomes are and a little bit of their background and how they've started to sort of become very popular in this area, not just in your major domain of wound care, but in regenerative medicine in general.
Well, first, I think we should start with stem cells and just explain what they really are, because people hear stem cells, it's a buzzword. They think that they're some kind of, magical cure-all, and there's a promise to stem cells, and there's also some concerns or caveats.
Sure.
Stem cells are originally thought to be those cells which can convert into other cells. They're sort of like precursors, or just like the flour and water make pasta. It's the flour of the water, and then you go on and you can create the pasta.
Sure.
And so stem cells are thought to be that. However, that's only a certain variety of stem cells. Other stem cells are actually thought to influence other cells to either regenerate or convert into other things. So, for example, you can have lung cells which are influenced by stem cells to then change into a different kind of lung cell.
Okay.
And I think that is an important distinction. And the stimulus for changing into a different cell is some kind of stress that occurs in an environment in which one cell, the stem cells, influence the local cells in order to convert them into something else, or to at least change the way in which they behave. Now, the way that occurs is that stem cells will send out chemical signals to other cells, which in turn respond to those signals and will then bring about those changes. Those chemical signals are either shorter protein chains or amino acid chains called peptides, or sometimes they're in the form of nucleic acids. People are familiar with mRNA now because of coronavirus.
Sure.
And there is mRNA as well as something that's similar called microRNA, which are secreted by stem cells and then signal other cells to undergo changes or regeneration or even repair themselves. Now, the question is, how do the stem cells send those messages to other cells? Stem cells are often found sitting in solid tissue, and those are called mesenchymal stem cells. They tend to be stationary, so it's not as if they're running around to those cells that they're acting upon and then sidling up to them and saying, hey, you need to do this. Instead, they're remotely sending a signal through the fluid that surrounds the cells in order that the cells will then behave in a certain way. Now, you could conceive of them just sending out these small molecules However, within most of the solid tissues where these stem cells live, there are various enzymes that, if you had free-floating chemicals, would within minutes eat up those free-floating chemicals. And the idea is, how do you avoid having those chemicals exposed to those enzymes? And so how does the message get sent? Well, fast forward beyond the world of stem cells, where people have seen them act in certain ways, and it's been determined that the likely signaling mechanism is an envelope by which those chemicals are surrounded, and then the envelope then is free floating in the fluid. It renders the biological molecules impervious to attack by those enzymes. And so ultimately those envelopes, which are secreted by the stem cells and then go to the biological molecules, then contain the biological molecules, then go to the target cells, or the cells that are acted upon, and they coalesce with those cells and thereby avoid the degradation of the biomolecules. Those particular envelopes, which are made of fatty acids, are called extracellular vesicles. And that basically means a bubble of fatty acids that surrounds something, and that is secreted by a cell and then sent to the outside of the cell to then go and potentially act upon other cells. So exosomes are a variety of extracellular vesicles, which come in many sizes. Some of them are quite large and visible under a microscope under some circumstances. And some of them, like exosomes, are quite small and require very specialized ways to actually even see them. And that would be using an electron microscope in order to visualize them. Exosomes are about the size of what we know of as coronaviruses, which are between 60 and 130 nanometers, which is exceedingly small. And they're much smaller than bacteria and tremendously smaller than human cells.
Mm-hmm.
That notwithstanding, an interesting point, people are familiar with the mRNA vaccines, specifically the Moderna and the Pfizer vaccines for coronavirus. Those are very useful as an example of what is like an exosome. The way those are created is they'll take small biomolecules. In the case of coronavirus, the genome, which is messenger RNA or mRNA, they will mix the mRNA with the fatty acids, shake it up in some specialized way, and then that creates bubbles or nanovesicles which surround the mRNA, and then that constitutes the vaccine. And that is a synthetic nanovesicle, or which isn't really an exosome because it's not created by a cell, but it's very similar.
Mm-hmm.
A non-synthetic or natural exosome is created by a cell. Okay. And the vaccine, which is the synthetic nanovesicle, contains only mRNA, whereas exosomes usually have a collection of different biomolecules, including mRNA, microRNA, and peptides, which are cell signaling molecules called cytokines.
Sure. Talking about that, am I still coming in okay?
Yep, just fine.
Perfect. Okay. Continuing along that, and what you're pointing out, this sort of this fascinating array of different types of molecules, everything from the large proteins, the peptides, the microRNAs. And, you know, on the Exocel website, it talks a little bit about sort of the analysis done in terms of what growth factors are there, what anti-inflammatory proteins are there. And it really is a fascinating sort of, you know, it's a very nice story that shows sort of what nature produces and what in terms of our body produces, you know, things here like VEGF, vascular endothelial growth factors, and bone morphogenic proteins and all and so forth, a lot of anti-inflammatory type cytokines. Obviously, a lot of this stuff great for the wound healing domain, other areas of regeneration. Talk just a little bit about, you, if you would, a little bit more about sort of this, sort of these combinatorial mixtures that are found in exosomes. I think that it's very important to compare and contrast sort of what we normally think of as a drug or a pure biologic like an insulin with really the combinations that exosomes are known to contain.
Well, I think as an example, I'll talk about how wounds are healed, because that can at least give people something to hang their hat on.
Perfect.
Wounds are healed, especially acute wounds, through several processes. Number one is blood coagulation, which actually releases different cell signaling molecules, likely through extracellular vesicles, which then attract in an array of different kinds of cells to fill in the hole that occurs with an acute wound. For example, if somebody gets a cut with a knife, that immediately starts a process by which, first of all, some cell signaling molecules are released by the blood clotting cells, platelets, and in turn, those molecules that are released will attract in what are called inflammatory cells, white blood cells, and different types of cells and they're brought in likely, if you think about it, the process is to clean up the dead tissue and the mess that's left over after the injury. On top of it, those particular cells likely release cell signaling molecules as well, and then attract in other cells. So there's several different levels of what occurs. Number one is the injury and the blood clotting. Number two is the migration of different cells in response to the biomolecule signals. And number three is more biomolecule signals, which then attract in different kinds of cells and bring about what I think is best described is an orchestrated pattern of healing. And by the same token, regeneration requires different biomolecules released in an orchestrated fashion in order to either bring about healing, regeneration of cells, cell division, and revitalization of cells themselves. That's always hard to say, by the way, cells themselves. So in any event, exosomes, specifically those created by Exocel Bio, our company, are created by mesenchymal stem cells that are derived from human placenta. Exosomes produced by mesenchymal stem cells, or stem cells found in placenta, and placenta is in effect a solid tissue, and they reside in the solid tissue of placenta. Those exosomes are involved in growth and regeneration because clearly they're involved in, to a certain extent, in the development of a human fetus. And those particular exosomes contain biomolecules that will be involved in the division of cells and the differentiation of cells, which meaning that cells turning from one thing into another and becoming more complex in the process of the development of a human fetus. And so that probably on a 30,000 foot level is the best way to look at it.
Mm-hmm.
Trying to get into the individual function of the cytokines and the exosomes and also the different kinds of RNA is probably beyond the scope of our discussion.
Yeah,
but in general, these are cells that are just designed to help promote growth and differentiation in a fetus.
Yeah, I think there's an excellent point there that obviously, the method, and I come out of pharmaceutical industry for most of my career, but the method has always been, what does this particular growth factor do? And let's study it for 10 years. But, these combinations are much more complex. And as you were pointing out, things like wound healing, things like regeneration, it's not about one compound, it's about complexity. And I think there's an elegance here to what these exosomes can do. Something else very interesting, as you're talking about wound healing, you point out like when that wound is healing, it needs some inflammation, but also the inflammation needs to know when to stop. So it's not about, anti-inflammatory, pro-inflammatory, it's about a balance, which is really exciting. Talk a little bit more about, if you would, some of the obviously nothing confidential, but some of the clinical indications, obviously beyond wound healing, that the company is thinking of. I know you have some anti-inflammatory thinking going on there, but what are some of the things you're going to be going after in the coming years?
Well, our initial target is the low-hanging fruit of aesthetic medicine. Okay. Because it is quite evident that in selected patients, exosomes, for example, injected into the scalp, may promote some regeneration of the stem cells in people who have balding, mm-hmm. and it may promote scalp regeneration and hair regrowth. So sometime in the future, we're looking at clinical trials to evaluate the potential of exosomes as an injectable product going into the scalp. We're not there yet. Currently, our indications are topical. We recommend it as topical use only, and that's really just so that we're following FDA guidelines and not making claims of safety or that we can create certain outcomes as yet, because we really haven't gone through the regulatory scrutiny in order to make those claims or get those indications, and we haven't even done full clinical trials. And in the future, we want to actually do clinical trials. Now, to understand clinical trials, because some of your listeners may or may not know, it's important to do a study where you, first of all, looking at safety.
Sure.
And so if we're thinking at someday about injecting these into the skin, it's important to know whether or not people have a reaction when you inject it into their skin, and if it's safe to do. And initially you would test it out in healthy volunteers, and then if it's deemed safe, then you can go on and do what's called a clinical trial, which is where you're evaluating compared to what is called control, mm-hmm. Which is something that doesn't contain the substance you're testing. And you compare and see if there's an increased activity or some change that occurs when you're comparing to the control, which may or may not have any change whatsoever. So for example, if we were to do a study of the scalp and hair regrowth, we would look at injection of exosomes into the space called the intradermal space, which is just below the first level of skin. And then compare that with injection of saline, which would be the control, which shouldn't have any biological activity. And then we would look at the density of hair regrowth over time compared to the scalp that was injected versus a scalp that was not. And it requires fairly large numbers of patients or subjects before you can actually make that determination.
Mm-hmm.
So, you know, that's the ultimate plan.
Mm-hmm.
Nevertheless, we're not there yet. Currently, we are marketing it. You can use it topically on your scalp or on your skin. For example, I have patients, I have an aesthetic practice as well. I hadn't actually mentioned that. And in my aesthetic practice, we utilize what are called non-ablative fractional lasers. And what those do is regenerate or rejuvenate the skin by creating a minor partial thickness injury or burn over small areas of the skin using a laser. And ultimately, it refreshes and rejuvenates the skin, gets rid of fine lines, gets rid of wrinkles, etc. The trick that we've learned is that people who don't get treated with exosomes, for example, normally have a 3-day period where their skin is bright red, kind of hot, not exactly painful, but definitely discomforted. And they don't see a maximal result until they've had 3 of these treatments separated by about 30 days each. So it takes 3 treatments over 60 days. And then again, 6 weeks after the final treatment, you see a maximal result. Mm. Well, this is just an anecdote. I can't claim this as being valid, but everyone that I've treated after one of these, their very first treatment, you treat them with the topical exosomes right after treatment. First of all, the pores are open because you're heating up the skin. And so they absorb the exosomes. Second of all, within less than 12 hours, they're what's called post-treatment erythema or post-laser redness is gone. Mm-hmm. And their skin is more comfortable, doesn't feel as hot. And I find that a lot of these people appear to have the same results in 30 days before their second treatment that they would after 3 treatments separated by a total of 60 days. And so there is some effect. Again, it's an anecdote. We don't have enough numbers of people to actually make that claim. But there is a suggestion that somehow the anti-inflammatory effect of the exosomes reduces the downtime, so to speak, after the laser treatment. So people are, able to get out and go about their daily business and do their Zoom calls within short order after using the exosomes. And I think they get a better cosmetic effect. Again, this is a matter of my opinion. It is not valid science at this point in time.
It's, I enjoy the anecdotes anyway, and, put enough of them together and, you see trends, and I think that's important. You point out something very interesting as well there that, the skin is the one place that, obviously there's biologic stuff going on that where you can apply the exosomes, but also you have the ability to modulate things physically, as you're saying, with the lasers. I was just, thinking a little more futuristically, but just for, because we've talked on previous shows about things like this sort of emerging area of electroceuticals, about, electrical stimulation for wound healing, things like that. Do you foresee other interesting combinations, like with the laser type approach, other methodologies for the skin that can be used in combination with exosomes, sort of in these manners?
Well, sure. I mean, you can also use it with microneedling. Currently, people, the standard is after microneedling to use PRP, or platelet-rich plasma,
Okay.
which is where you take somebody's blood, you spin it down, and then you take the plasma, which is likely rich in platelets, which are also, to a certain extent, ruptured platelets, which may contain some of those biomolecules that we were talking about, which are involved in wound healing.
Mm-hmm.
And because, as I mentioned, bleeding and clotting are the first step of wound healing, and those involve platelets. So these platelets will work on the skin when you have done some microneedling, which is another type of partial thickness injury. Mm-hmm. And they can potentially absorb, or at least their biomolecules can absorb. The issue is that exosomes are likely much richer in biomolecules than platelets, and appear to have, again, anecdotally, a better result than if you use platelet-rich plasma. Now, I do know some providers who are using both exosomes and platelet-rich plasma after microneedling, and I even know some people who are injecting scalps with platelet-rich plasma as well as exosomes. We have no way of knowing whether the combination is truly advantageous. I mean, it's not always the case that if a little is good, a lot is better. Right. And combination therapies may or may not work in concert to produce something that's a positive result. They may work against each other. And so I can't endorse that. I can endorse the use of exosomes after microneedling. I've used PRP after microneedling, and it does have a positive effect, but I think that exosomes have an even greater effect.
And Roger, you talked early on when we were talking about sort of the wound care practice and sort of wounds taking much longer to heal as you get older. You've been involved in court cases focusing on elder abuse in this particular context. Obviously, we can't say much today, but obviously on this show and a lot of places, aging and healthy longevity biotech has become such a hot area lately. Take a few minutes just to talk about your thoughts on systemic aging, if you would, and ultimately where we potentially could be going with exosomes as systemic therapies for various forms of healthy aging, or to reduce the sort of the negative effects of aging.
Well, it's the great unknown, but at least from a common sense standpoint, exosomes derived from stem cells that are involved in the development of neonates, of infants and fetuses, are likely to have some significant anti-aging and regenerative effect. The question is how to use them. Can they be used systemically? There are people who do off-label use intravenous exosomes. Yeah. That's not our policy as a company, but I do know of people who use them. The question is, what do they do as far as cellular aging? If you give them one time, do you give them once a month? Do you give them twice a year? Nobody really knows. Right. And nobody has yet studied the effects of placental-derived exosomes on, for example, telomere length, which at this point in time is thought to have some relationship with anti-aging or reversal of aging. So it's a great unknown. It's sort of the next frontier. My personal belief, and again, it's only belief or opinion, is that exosomes may be part of the puzzle in terms of forestalling or reversal of aging. And again, we will get better at determining what biomolecules are specifically involved in anti-aging. I think exosomes are a piece of that puzzle because you have to have a way of delivering those biomolecules without them being degraded by the enzymes in the body.
Yep.
They have to be able to get to the target cells in order to bring about cellular regeneration or rejuvenation. So exosomes in some form, I believe, will be involved in that. And at some point in time, we will get better at creating exosomes so that we can, in effect, tweak the stem cells to package very specific biological molecules at specific times so that we can then orchestrate cellular repair and regeneration. I think we're not there yet. I think it's going to require several decades of different types of clinical trials and development of the technology.
But it's going to be exciting times, and yeah, it's fascinating the work that you're doing and at this level, and really starting off and understanding all the possibilities here. And it's yeah, it's just really encouraging, and I'm really wishing you the best with a lot of these programs. For everybody that is going to be listening to this particular episode on our podcast or watching on the YouTube channel, you've been listening to Dr. Roger Schechter, Chief Medical Officer, Exocel Bio, merging the technologies of exosomes and nanoparticle technologies for therapeutic applications in cellular regeneration. He's also Medical Director, Wound Management, Palomar Health in San Diego, Chief Medical Officer, Synergy Wound Technology. Roger, it's really fascinating work. I want to thank you again for taking the time out of your schedule to come talk to us for a little while. I want to thank you for all the work you're doing there. And as we say on the show, thank you for helping to create a better tomorrow via this research, via these technologies, and really inspirational stuff. And just thanks again for coming on the show.
My pleasure. Enjoyed it.